The love potion, the stuff of myths and legends and Shakespeare. MDMA is a psychoactive substance classified as an empathogen. It was first patented in Germany in 1912 to serve as a parent compound to synthesize medications to control bleeding. Even without FDA approval, psychotherapists began using it to enhance introspection and communication. In 1985, it was banned by the DEA. MDMA moved underground and into the rave scene, where it lived for 2 decades and became known as ecstasy or Molly. In 2004, the FDA approved a study into researching its efficacy for psychotherapy. The first clinical trials for MDMA-assisted psychotherapy for PTSD began in 2011, and after just a few years, showed promising results indicating that MDMA can be a powerful therapeutic tool for PTSD. One of the main challenges of treating PTSD with psychotherapy is that by working through a traumatic event, a patient would often be re-traumatized. MDMA allows a patient to revisit the event without having to relive the event. A typical psychotherapy session involves ingesting 125 milligrams with an optional half dose 2 hours later. The therapist will guide a patient as they talk through past emotions and events. MDMA properties work in tandem to create what researchers call the optimal arousal zone. MDMA can reduce activity in the amygdala, which mediates the fear and anxiety responses associated with the traumatic event. It stimulates the release of monoamine neurotransmitters, serotonin, dopamine, and norepinephrine, and/or blocks their reuptake, thereby elevating mood. The research suggests that a patient may feel safe and observe oneself with more compassion and love due to elevated levels of oxytocin, colloquially known as the love hormone. Frontal cortex connectivity, which aids the brain's higher cognitive functions, is increased, helping the brain better process the event. Afterwards, the patient will work in integration sessions to help consolidate the therapeutic breakthroughs. A 2020 analysis from 6 different MDMA clinical trials found that after exiting the study, 67% of the participants no longer met the criteria for PTSD. The majority reported improved general well-being, increased social ease, and better relationships. It can be alienating to be in a relationship with someone suffering from PTSD. One way to work through PTSD is cognitive behavioral conjoint therapy, where partners or family members are included in the treatment. In recent trials, MDMA-assisted psychotherapy has led to very positive results. MDMA appears able to help create a safe, empathic space, allowing the partner or family member into the world of the trauma. No longer locked out, the partner and the patient create strong bonds. Studies are showing positive results in using MDMA to treat those facing life-threatening illnesses, autism anxiety disorder, and alcohol dependence disorder. No, MDMA is not a love potion, but it could help you love you and others again.
Psychable does not encourage illegal activity, including the illegal sale, purchase, or use of controlled substances. Psychable content is for informational purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you've seen in a psychable video. If you are experiencing a health emergency, immediately call 911.